Welcome to my channel. Today we're going to discuss computed tomography. We will discuss the basic principles as well as the geometry and historical development. Mathematical principles of CT were first developed in 1917 by Radon, proved that an image of an unknown object could be produced if one had an infinite number of projections through the object. Plain film imaging reduces the 3D patient anatomy to a 2D projection image. Density at a given point on an image represents the X-ray attenuation properties within the patient along a line between the X-ray focal spot and the point on the detector corresponding to the point on the image. With a conventional radiograph, information with respect to the dimension parallel to the X-ray beam is lost. Limitation can be overcome to some degree by acquiring two images at an angle of 90 degrees to one another. For objects that can be identified in both images, the two films provide location information. The tomographic image is a picture of a slab of the patient's anatomy. The 2D CT image corresponds to a 3D section of the patient. CT slice thickness is very thin, ranging 1 to 10 mm and is approximately uniform. The 2D array of pixels in the CT image corresponds to an equal number of 3D voxels, or what we call the volume elements in the patient. Each pixel or picture element on the CT image displays the average X-ray attenuation properties of the tissue in the corresponding voxel. Single transmission measurement through the patient made by a single detector at a given moment in the time is called a ray. A series of rays that pass through the patient at the same orientation is called a projection or a view. Two projection geometries have been used in CT imaging. First, parallel beam geometry with all rays in a projection parallel to one another. Second, a fan beam geometry in which the rays at a given projection angle diverge. The purpose of CT scanner hardware is to acquire a large number of transmission measurements through the patient at the different positions. Single CT image may involve approximately 800 rays taken at 1,000 different projection angles. Before the acquisition of the next slice, the table that the patient lies on is moved slightly into cranial cauda direction. Each ray acquired in a CT is a transmission measurement through the patient along a line. The unattenuated intensity of X-ray beam is also measured during the scan by a reference detector. There are numerous reconstruction algorithms used in the CT scanner. Filtered backprojection reconstruction is most widely used in a clinical CT scanners. Builds up the CT image by essentially reversing the acquisition steps. The micron value of each ray is smeared along the same path in the image of the patient. As data from a large number of X-rays are back-projected into the image matrix, areas of high attenuation tend to reinforce one another, as do areas as low attenuation, building up the image. Now let's proceed to the historical development of CT scanner. First generation, or the rotate translate acquisition. It has a pencil beam type, only two X-ray detectors, use two different slices. It has a parallel ray geometry, translated linearly to acquire 160 rays across a 24 cm field of view. rotated slightly between translations to acquire 180 projections at 1 degree intervals, about 4.5 minutes per scan with 1.5 minutes to reconstruct the slice. The first generation has a large change in signal due to increased X-ray flux outside of head. Sodium iodide detector signal decayed slowly, affecting measurements made temporarily too close together. Pencil beam geometry allowed very efficient scatter reduction, best of all scanner generations. Second generation has the rotate translate acquisition with a narrow fan beam. It has a linear array of 30 detectors, more data acquired to improve image quality. Shortest scan time was 18 seconds per slice, and narrow fan beam allows more scattered radiation to be detected. Third generation, on the other hand, has a rotate-rotate acquisition with a wider fan beam. Number of detectors increased substantially to more than 800 detectors. Angle of fan beam increased to cover the entire patient. Eliminated need for translational motion. Mechanically joined X-ray tube and detector array rotate together, and newer systems have a scan time of 1.5 seconds. The only disadvantage of the third generation is that of ring artifacts. The rotate-rotate geometry of the third generation scanners leads to a situation in which each detector is responsible for the data corresponding to a ring in the image. Drift in the signal levels of the detectors over time affects the values that are projected to produce the CT image, causing the ring artifacts. Fourth generation has a rotate stationary acquisition designed to overcome the problem of the ring artifacts. Stationary ring of about 4,800 detectors. Third generation fan beam geometry has the X-ray tube as the apex of the fan. The fourth generation has the individual detector as the apex. The fifth generation with stationary acquisition, developed specifically for cardiac tomographic imaging. No conventional X-ray tube, large arc of tungsten encircles patient and lies directly opposite to the detector ring. Electron beam steered around the patient to strike the annular tungsten target. Capable of 50 millisecond scan times, can produce fast frame rate CT movies of the beating heart. The sixth generation, or the helical CT scanner, acquires data while the table is moving. By avoiding the time required to translate the patient table, the total scan time required to image the patient can be much shorter. Allows the use of less contrast agent and increases patient throughput. In some instances, the entire scan can be done within a single breath hold of the patient. Seventh generation with a multiple detector array. When using multiple detector arrays, the collimator spacing is wider and more of the X-rays that are produced by the tube are used in producing image data. Opening up the collimator in a single array scanner increases the slice thickness. reducing spatial resolution in the slice thickness dimension. With multiple detector array scanner, slice thickness is determined by detector size, not by the collimator.